One of the very common characteristics that we see in forensic psychology is the identification of personality disorders. And so the case studies that we'll be looking at in this project will be dealing with individuals that tend to suffer from one type of personality disorder. They may also suffer from different mental conditions and may also have a secondary personality disorder being associated with them. But this lecture is going to look at the psychology of what personality disorders are and what types that you may find in individuals. So by definition, a personality disorder is referred to as some kind of a long-standing, pervasive, meaning that it invades the entire personality, of inflexible patterns of behavior. Personality disorders will depart from any kind of cultural expectations. They can impair an individual's social, occupational functioning, and they can cause severe emotional distress in the individual as well as others around them. The prevalence of personality disorders, they are fairly rare. You will find them about 0.5 to 2.5% of the general population. They tend to be found higher in inpatients versus outpatients in clinical settings, such as in mental institutions. Their origins and how they come about, they are thought to begin primarily in childhood. They tend to run a chronic course if they're untreated. They do have high comorbidity rates, which means that you will find individuals with personality disorders also exhibiting other mental disorders. They tend to be more prevalent in males than they are in females, even though some specific personality disorders will be more in females than males. It kind of depends. Personality disorders are going to fall into one of three categories, or sometimes referred to as clusters. The persons that are personality disorders that are found in what we call category A, which are referred to as the odd or eccentric personalities. This would be a paranoid, a schizoid, or a schizotypical personality disorder. Generally, when we say odd in psychology, these are what we would call the crazy people. Personality disorders in category B would be ones that are more dramatic and having emotional or erratic type behaviors. In this category, we will find the antisocial personality disorders, borderline, histrionic, and narcissistic personality disorders. Antisocial will be one that we focus mainly on in talking about the different case studies. In the category C, these are the anxious or fearful type personality disorders, and this is where we'll find the avoidant, dependent, and the obsessive compulsive disorders. So let's look at each one of these. In the odd eccentric, which is category A, we will find one example is the paranoid personality disorder. This disorder does not exhibit any kind of hallucinations or any kind of delusions. Paranoid personalities disorders occur more frequently in men than women, and their lifetime prevalence is about 1% of the population. In a paranoid disorder, as the name implies, they always are assuming something's out to get them. A schizoid disorder is the second odd eccentric type. This involves a reduced social relationships. There are very few friends. They have a reduced sexual desire, few pleasurable activities. Their indifference to praise or criticism, they don't care if you like them or not. They tend to be very isolated, live lonely lifestyles, and they are about 1% of the population, more common in men than women. A schizotypical personality disorder, this is usually has a comorbidity associated with the diagnosis of schizophrenia. These individuals have some very odd thinking processes. They tend to have what we call delusional type behaviors that, For example, one would be, I believe I'm the king of the world. It's a belief. Delusions are false beliefs. They can have hallucinations. They can see things that are not present. They can hear things that are not there, hearing voices, seeing things. They tend to look at things and say, oh, what we would assume the meaning of, a red light means to stop. A red light to them may mean something different. And it's usually an odd kind of thought process as to why red means what it does to them. They can be in society looked at as very eccentric, and they are actually fairly high in our society. About 3% of the population would exhibit this type of personality disorder. We can find them. And again, you would see that more prevalent in men than it is in women. The etiology, which means what causes it, is somewhat linked with the following. These disorders tend to be linked with a severe psychiatric mental condition called schizophrenia. You will tend to, if you have a diagnosis of schizophrenia, you probably also have a diagnosis of one of these personality disorders. Schizophrenia has also been looked at biologically, and there seems to be a very high genetic determination that schizophrenia does fall within family lines. So individuals that do exhibit these personality disorders, you can actually trace them through family lines. And more specifically with the schizotypical and the paranoid, they don't seem to find a huge genetic link with the schizoid type personality disorders. But I think the important thing is that these odd eccentric category of personality disorders, they tend to be linked, this is the comorbidity, with another mental condition referred to as schizophrenia, and they tend to also have some genetic determination. The category B personality disorders, these are the borderline, narcissistic, antisocial, and histrionic disorders. And let's look at each one of these. With a borderline personality disorder, these individuals cannot maintain any kind of stable relationships. They try to avoid relationships because they have a fear of being abandoned. They tend to have very poor self-image of themselves. You will see severe mood swings. They feel empathy, meaning they can understand how others feel, but they don't know how to deal with it. They can be very impulsive, so you'll see people with borderline disorders abusing substances. They can be suicidal. A lot of times they will attempt to commit suicide for attention-getting reasons. This disorder tends to run in families. It is also connected with other mental disorders referred to as mood disorders, so that would be the comorbidity of that. And you tend to see borderline personality disorders evolving due to early childhood type abuse situations. In terms of being able to treat a disorder, there are very few treatments available. Very few studies have shown any effective treatment. Dielectric behavioral therapy has been used. This is referred to as electroshock treatment, and some medications such as antidepressants and mood stabilizers such as lithium will also be used a lot of times. But the problem with personality disorders is they are very pervasive, meaning they last a long time. You really can't change them. The histrionic personality disorder, on this one, people here exhibit symptoms such as they tend to be very over dramatic and attention seeking. They will be very emotional, but they are very shallow in their thought processes. People who are self-centered and overly concerned about physical attractiveness tend to be of the histrionic type. They will be about 2% of the population, 2 to 3%, and we tend to find them more in women than we do in men. The narcissistic disorder, this involves somewhat of the idea that you have this grandiose view of your own importance. It's like you always like to look at yourself in the mirror and think that you're the most beautiful thing in the world type of feeling. They have a very strong sense of entitlement. They do not feel empathy for others. It's usually just all about me. I don't really care about you. I only care about how it affects me. Narcissistics are very low in our population, about 1%. And interestingly enough, again, we tend to find them more in women than we do men, but it isn't, men do exhibit also narcissistic disorders. And here we get to the most important, I think, personality disorder that we're going to look at in this unit, and that is the antisocial personality disorder. Here, this is a disorder that occurs in conduct disorders. To be classified as a personality disorder, you will have some kind of a conduct disorder before the age of 15. Conduct disorders are usually linked with legal crime activities, such as being truant from school, lying, theft, arson, running away from home, destruction of property. And most, don't freak out that people like, oh, I've done all those things. It's usually to the extreme. Not because most, as we grow up, we do things that are kind of stupid, and we pay the price for it as a consequence, and we probably don't ever do it again. With antisocial personality disorders, the pattern repeats, and they don't seem to have a consequence. They don't feel that a consequence really works for them. So you can punish them all you want, and they're still going to do it. These behaviors then that evolved in early adolescence will continue into the adulthood. We tend to see this at about a rate of 3% in men. So this is an interesting one because they do have a lot of data here that we're going to see a higher rate in men than we do women. We find antisocial, women will exhibit other personality disorders, but not so much the antisocial. Not to say there are not antisocial personality disorders in women, because there are. There are some examples that we'll look at as a case study, but you will see it more present in men. The cause, etiology, tends to be a developmental type of sequence. We tend to see that early on this personality disorder is going to evolve based upon some things that happen in their early childhood. So things like lack of affection, severe parental rejection. They would have inconsistent or no discipline whatsoever at all. When we've looked at twin studies, they can show a greater concordance for antisocial personality disorders in twins, in male twins versus female twins, or in maternal twins versus paternal twins. Adoption studies, we have adverse adoptive environment, maybe stressor triggering. So a lot of time when kids are put up for adoption or abandoned by a family and then later adopted, if they go through the foster care system, we tend to see a little higher rate of personality disorder, antisocial personality disorders developing. And this is basically kind of a post hoc research. We've looked at individuals that have been incarcerated for psychopathic kind of crimes, such as the case studies we'll be looking at, and kind of looking at what happened to them early in their life and kind of making these determinations that that's probably why their personality developed the way that they did. To treat a antisocial personality disorder is very difficult to almost impossible. Many do not see that they have anything wrong with them, so they're not going to seek treatment. If they are forced to undergo some kind of a treatment, it could be medication, it could be electroshock, it could be therapy, talk therapy. The prognosis for improvement is almost non-existent. They just will not improve. What we tend to do here with antisocial individuals that are severely antisocial, such as criminally antisocial, we focus on prevention, meaning that we lock them up. They get put away and they really truly cannot be let loose in society again because they're never going to improve. And they will probably continue to commit crime if they're doing it or whatnot, abuse, etc. For the rest of their lives. So the best form of treatment really would be to remove them from society by incarcerating. The last category that we're going to look at are called the anxious and fearful category. These are the anxious avoidant personality disorders, dependent personality disorders, or the obsessive compulsive disorders. With the anxious avoidant, these are people who are fearful in social situations. They are very sensitive to criticism and rejection or disapproval. People whose lives and jobs are restricted by their fear of negative interactions. So these individuals tend to not get out into society. They are homebound people usually, or people who work from home. They can still work and earn a living. They just would prefer to be by themselves and work alone. They're probably not going to interact well, and they don't take criticism well. You can really see some severe behavioral responses, acting out behaviors. We tend to see this very low in our population. They also are very, you will also see the anxious avoidant in conjunction with other forms of personality disorders, comorbidity. That would be the dependent group, we'll talk about next, and the borderline group. Treatment, basically with the avoidance, what would they try to do is get people to do things they don't like to do. So if you don't like to go out into society, they try to get you to go out into society and learn some anxiety reduction treatments. They could also take medications to do that. So what they try to do is expose you to situations that cause you to be anxious, and over time hopefully desensitize you to that. Sometimes that works, a lot of times it doesn't. Personality disorders are almost impossible to cure, but there are some treatments that they have tried. With a dependent personality disorder, here the symptoms tend to be a lack of self-confidence, a lack of self-autonomy, meaning they just can't do things by themselves. They tend to view others as very powerful, where they see themselves as very weak. So they're more of a submissive type versus a dominant type. You tend to see this more in women. Once again, this personality dependent is more in women, but I have seen it in men. And it's the idea that you have to have somebody else in your life to make your life complete. You can't do it by yourself. You have to be dependent on somebody else. So in terms of how to treat that, that's a little tough. The last one is the obsessive compulsive disorder. You see that a lot in movies and stuff recently. These are individuals that have to have everything perfect. They have certain rules and orderliness that they have to follow. These are called routines. They're very inflexible about changing their routine. If you watch The Big Bang Theory, the character Sheldon is an obsessive compulsive. He has to knock 3 times on a door and say the person's name. He has a spot that he can only sit in on the couch and nobody else can sit there. That's an example of an obsessive compulsive. They do not see that they have anything wrong with them. They believe what they believe, and if you don't agree with them, then you're wrong. I'm not wrong. They're very much of the perfectionist type, depending on what their compulsion is. The obsessive means it's a thought. I believe this. The compulsion is I have to do it. So I believe if I don't knock on the door 3 times and announce the person's name, then something bad will happen. And so the compulsion is every time you knock on a door, you have to do it 3 times. If you don't do it 3 times, then you can have a real severe anxiety panic attack with that. There is medication. There is some psychotherapy that they work with obsessive compulsives with, but it would have to be an ongoing type of treatment. It's not a one and done deal. It's very hard to break an obsessive compulsive, both thought patterns and behavioral disorders. So ways to look at treatments. Treatments vary. You can read through this slide. Most of the treatments can be both medication, some behavioral treatments such as exposure to anxiety producing events, as with the Antisocials, the real form of treatment for a severely antisocial personality disorder would be incarceration or locked away in a facility and remove them from society, etc.